Good evening. I'm psychiatrist Jay Fawver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720. Or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, I am broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fawver, I have ADHD. What's the difference between Strattera and Qelbree? Strattera is atomoxetine. Qelbree is phenyloxetine. My nurse practitioner is recommending either of those. Well, Strattera versus Qelbree. Strattera has been out for a couple decades now. Strattera is a medication that specifically and selectively will increase norepinephrine in the front part of the brain. So part of the problem with attention deficit disorder is that you don't have enough transmission of norepinephrine, and particularly in this left frontal part of the brain that's used for focus, concentration, attention span, blocking out outside distractions. And people with attention deficit disorder have about a 5% decreased activity in this left frontal part of the brain. What you're wanting to do is fire that part of the brain up. How do you do it? You can increase norepinephrine. How do you increase norepinephrine? Well, Strattera or atomoxetine is one way of doing that. If you increase norepinephrine, it can fire up this part of the brain. With Strattera, it's a medication that will give you about a 90% increased blockade of the norepinephrine. Now, when you say blockade norepinephrine, you might think, well, gee, I just heard you say you're increasing norepinephrine. What you're doing here is you're blocking the vacuuming of norepinephrine into the firing neuron. So if you think about the neurons as being like shotguns, they're firing out norepinephrine pellets. These pellets go to several different receptors in the periphery, then they get sucked back in to the firing neuron. Well, what Strattera is doing, it's blocking the vacuuming of norepinephrine back into the firing neuron. About 90% blockade at that with usual doses of Strattera. Qelbree, on the other hand, is blocking about 50% of the norepinephrine blockade, but it's also doing something very importantly. It's blocking two serotonin receptors. One is serotonin receptor type 2B, as in boy, and one is serotonin receptor type 7. What that's going to do is not only give you some increase in norepinephrine here, but it's also going to increase serotonin in the front part of the brain. Why would you want to do that? A lot of people with attention deficit disorder will have difficulty with focus and concentration, but they also have a lot of anxiety because they're always procrastinating. They're getting behind on things. They're not getting stuff done. They're worrying about all these different obligations that they're overlooking, and they're finding that they're not completing because they don't have enough vigilance. Well, because of that, they have a lot of anxiety. So if you block serotonin receptors 7 and 2B, indirectly, you increase serotonin transmission in the front part of the brain, and by doing so can decrease worry and anxiety. It's not that you'll be less motivated to do things. It's just that you don't have the degree of obsessive rumination that you might have if you didn't have that on board. So Qelbree on one hand, Viloxazine is the generic name for that. Qelbree is a medication that does increase norepinephrine like the Strattera, but it also will give you a little bit more of an anti-anxiety effect. Strattera, or atomoxetine, is a medication that more specifically and selectively just increases norepinephrine. Qelbree is brand name. It's newer, so it's going to be more expensive for many people. It will require, not uncommonly, a prior authorization with many insurances. Strattera, atomoxetine, has been around since, about 25 years now, so it's been around for a long time. So it's very easily acquired at this point. Thanks for your question. Let's go to our first caller. Hello, Phil. Welcome to Matters of the Mind. Phil, you'd mentioned that you started a Daytrana patch for ADHD. Daytrana is methylphenidate. That's a Ritalin-type product. You started it for ADHD, and you've noticed a decrease in your appetite. Is that normal? It can be a side effect, Phil. If you take Daytrana, you're taking a slow-release version of Ritalin, methylphenidate. And in doing so, it's related to the dosage, but you can have a decrease in your appetite. Now, it's not a problem for a lot of people unless it's problematic and you're decreasing your appetite to the point where you're losing weight that you don't want to lose. Now, many people like the weight loss, and they get disappointed because the decrease in appetite and the weight loss will often diminish as time goes on. So many people say, I need to increase my dosage because I'm not having the weight loss anymore. Well, that's a side effect, and side effects with many medications will diminish over the course of time. So with the Daytrana patch at this dosage, the first question you need to ask yourself is this dosage really helping my concentration, my focus, my distractibility? Is it helping me be more productive? Am I getting things done? Am I getting things completed? Am I overall calmer because I'm more focused and I'm more aware of my task at hand? On the other hand, if the Daytrana is not giving you that much benefit, but yet you have decreased appetite, you probably way overshot the dosage you need. Because if you take too much of a methylphenidate product like Daytrana, it's like getting eyeglasses that are too thick. And I often make this analogy, Phil. When you have poor vision, you get eyeglasses or corrective lenses that have a certain strength. And you start at a lower strength and you go higher and higher and higher, and you find the strength that works for you. But like with many corrective lenses, if you go too thick on the lenses, you actually see worse. The same is true with a Daytrana patch or methylphenidate. There's that fine line between efficacy or how well it works versus side effects. And you want to get the best benefits with as few side effects as possible, but sometimes when you overshoot on the medication a little bit, you don't get as much efficacy, it doesn't work as well, and you get more side effects, and one of the side effects can be decreased appetite. So the first thing I would often consider if Daytrana is giving you a lot of difficulty with appetite is, number one, I'm going to wonder how well it's doing for your concentration and focus, but many times we might decrease the dosage a notch to this for the determination if it's giving you the same benefit that you might have otherwise. So we're always trying to find that right dosage. Going higher on a medication like a stimulant is not always going to give you better efficacy any more than getting thicker and thicker eyeglasses are going to give you better vision. You got to find that fine tuning point for you, not necessarily what works for somebody else, but you got to find the fine tuning point for you at what dosage works best for you for efficacy, how well does it work, in doing so, not giving you as many side effects as you might have to find intolerable. Phil, thanks for your call. Let's go to our next caller. Hello, Jacob. Welcome to Matters of the Mind. Jacob, you've been taking an antidepressant for 4 weeks, but you haven't noticed any significant improvement. Should you continue taking it or stop it because it doesn't seem to be working? Jacob, a rule of thumb with antidepressant medications generally will be at 2 weeks, you should get at least 20% benefit. And then at 4 weeks, you should get about 60 to 70% benefit. That's kind of how they work. 6 weeks to 8 weeks is where you get the full benefit from an antidepressant. So the question at 4 weeks, okay, number one, you're going to know it's 4 weeks if you're having difficulty with side effects, because antidepressant side effects often will be seen within the first 2 to 4 weeks. You'll see that very quickly, and then the side effects, if anything, start to diminish over the course of time. You should get a little bit of a benefit from an antidepressant. Just 20% or more is a good sign at 2 weeks, but at 4 weeks you should be getting a much better benefit than what you're describing. So if you're not finding that the medication is helpful for you at 4 weeks, talk to your clinician about the possibility of, number one, increase in the dosage, always considering the pros and cons of increase in the dosage, knowing you could have more side effects if you increase the dosage. But number two, is it the time to add other medication to it? If you're getting a 25 to 50% benefit from a medication, for instance, you're considered to be a partial responder. A responder is somebody who gets a 50% or more benefit. A partial responder is somebody who's getting a 25 to 50% benefit on a medication. If that's the case, and you're getting a little bit of benefit, sometimes we add something to it like Caplyta. We might add Abilify or Exalti. We add other things to it if you're getting a little bit of benefit from the medication at 25 to 50% at the 4 week mark. We often will consider if somebody has an alternative kind of mood disturbance like bipolar disorder. If you have bipolar disorder, you might be having some subtle highs and lows. You need a mood stabilizer in those cases, whereas an antidepressant medication might not be the best thing for you. And obviously, we're always going to be looking at medical conditions like thyroid disturbances, iron disturbances, glucose, sleep apnea. All those kind of conditions can cause an antidepressant medication to not seem to be beneficial because we're kind of chasing up the wrong tree for the wrong particular fruit we're trying to acquire. So if we're trying to treat somebody with an antidepressant and they actually have low thyroid, well, we need to go a different direction. And if you treat the low thyroid with thyroid supplement or whatever they may need, that'll often give people better outcomes. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, is it true that autistic people have lower levels of oxytocin in their bloodstream? What could some mental health treatments affect oxytocin levels negatively, leading to more emotional problems? Well, the oxytocin blockers are used in pregnancy by the obstetricians. Basically, if you block oxytocin in pregnancy, you block an early delivery. So if somebody has they go into premature contractions when they're trying to deliver a baby, oxytocin, which comes from the pineal gland, not the pineal gland, the pituitary gland, which is right smack in the middle of the brain, kind of hangs down the bottom here. It comes from the pituitary gland, and oxytocin goes sky high just at the time of delivery. That releases the calcium necessary to cause the uterine to contract. If you're going into premature contractions, sometimes oxytocin blockers will be given. So medicinally, that's where oxytocin blockers will be given. Now, what is oxytocin? What's its role in autism? It's thought that people with autism lack oxytocin, and thereby they have less activity in their mirror neurons in the right front part of their brain in particular. Mirror neurons, as the name implies, help you mirror the social behaviors of people around you. So mirror neurons help you kind of connect with other people and so-called read the room. If you read the room, you're understanding what kind of emotional valence is there and how you should respond to certain situations. Is it a happy, joyous type of environment? Is it more of a solemn environment? You know, you go to a funeral, probably not a good place to tell a joke. You kind of read the room and know what kind of social context you're in. Oxytocin helps with that bonding and helps you read the room in that regard. So with that being said, people with autism often have a disturbance early on in their lives, especially with decreases in oxytocin. For years, there have been studies being done, not yet approved, for oxytocin intranasal formulation, because if you take a pill of oxytocin, it's a peptide, it goes to the stomach, it all gets broken down, it's meaningless. So for oxytocin to get to the brain, you have to formulate it in such a way that it bypasses the so-called first pass effect. It goes through the liver and it goes right to the brain, and you can do that from an intranasal formulation. Not yet approved. So what kind of things lower oxytocin levels outside of the oxytocin blockers that I mentioned earlier in pregnancy? Alcohol. If you drink alcohol heavily, it can decrease oxytocin. And I think it's an interesting concept because think about it. If you drink a lot of alcohol, it can affect your interpersonal relationships, and it can certainly affect your marriage in a lot of different ways. But if you block the bonding hormone, oxytocin is the bonding hormone. It's the hormone of love. It's the hormone of romance. When you first fall in love, when you have sexual experiences, oxytocin goes sky high. It bonds you to the other person. So if you drink alcohol, it dampens down oxytocin, it decreases oxytocin levels, so it can certainly affect your ability to bond with your loved ones. So alcohol can decrease oxytocin levels. Another medication that can block oxytocin levels will be narcotics, so opiates. Narcotics, pain medications. If you use opiates for pain, if you use opiates recreationally for the purpose of feeling bliss, you're going to have often less bonding with other people because it will decrease oxytocin levels themselves. So medicinally, the medications that block oxytocin effects will be the medications used for preterm labor or early contractions during pregnancy, alcohol, and opiates. Those are the three things that mainly will dampen down oxytocin levels. And as you'd mentioned, autism can be a condition where there's this disturbance in oxytocin levels early on, giving people difficulty with that ability to bond with others. Thanks for your call. Let's go to our next caller. Hello, Leah. Welcome to Matters of Mind. Leah, you had mentioned your friends say that you have obsessive compulsive disorder due to your anxiety and tendencies to want to clean all the time. Is that something you should look into? OCD, obsessive compulsive disorder, is a condition where you can have ruminative thoughts that don't make any sense to you. They're called ego-dystonic thoughts. They don't make any sense to you. Those thoughts you can't get off your mind. So if you have a thought concerning contamination and you know it's illogical, you know it doesn't make a lot of sense, but you have these thoughts that go round and around your brain about contamination and being dirty and having germs all around you, well, what's happening there? This front circuitry of the brain is going round and around. Usually we'll have a thought about contamination. We'll say, oh, that's icky. And then in the front part of the brain, it stops further thinking about it and you move on. You stay away from the icky type of thing that you're around. So your brain has a natural way of sorting out, okay, is this a danger to me or not? So OCD will start typically with a thought that goes round and round and round, and you can't stop it because your orbital lateral prefrontal cortex, which is right here above the eyeball, that doesn't work so well. The orbital lateral prefrontal cortex will often stop this circuitry and allow you to move on. Compulsions are behaviors, and the behaviors are often a result of the obsession, so compulsions can be when excessive cleaning. Now, excessive cleaning. If you're in the healthcare industry, we're taught to obsessively be concerned about contamination and compulsively clean. So in healthcare, well, that's kind of an occupational hazard to have these so-called OCD tendencies. When I was in pharmacy school, before I became a physician, and when I was a pharmacist, we were taught to compulsively count 3 times the number of medications that we were giving somebody and also the label of the medication. We're always taught to compulsively check 3 times from the time we started filling that prescription to the time it left the pharmacy. So we're trained to have this compulsivity, even though we knew after one time, okay, we were good on that, we're taught to check it again and again. In the airline industry right now, again, they're telling people to compulsively check different things, even though they know they've checked them before, check them again and again. So there are some constructive compulsions, I guess you could say, but that's the question it comes back to. If you're compulsively cleaning, is it to the point where you're cleaning unnecessarily and you're cleaning even to the point where it's causing harm? In other words, are you cleaning so much that your detergents or your disinfectants are damaging to whatever you're cleaning? You often hear about the people who have the compulsive hand washing. Their hands are raw. If your hands are raw from compulsive hand washing because you're washing so much because you feel like you just can't get the germs and the dirt off, that's a problem. So the first question would always be, do you have OCD? OCD is where it's causing the obsessions, the compulsions are causing functional impairment. They're keeping you from getting things done. And a big question we often ask to determine if somebody has OCD will be, is it causing you to be late to various obligations or appointments? If you're at home rechecking, you're cleaning, you're doing things over and over again compulsively, and it's causing you to be late to get out the door, that's a big tip-off that it's a problem for you. Now, if you are somebody who goes back and checks the stove or checks the locks once, not a big deal. But if you're going back 3 and 4 and 20 times and it's causing you to be late to get out the door, that's where it becomes a problem. Now, where it's also a problem will be if you know you checked it or you know you cleaned 2 or 3 times, but you got to go back one more time. And if you can't go back one more time, it causes a lot of anxiety. That's classic symptom for OCD as well, where it's causing heightened anxiety if you can't do it one more time, even though you know you've already done it. Yeah, we do have medications now for OCD that appear to be effective. The medications that are most effective are the serotonin reuptake inhibitors, particularly the ones that will give you a stimulation effect at this particular receptor called sigma-1. Sigma-1 receptors, if stimulated, can decrease inflammation, and it seems to have some kind of effect for OCD. The medication we use for OCD, typically the prescription medications, will be Luvox, also known as fluvoxamine, and Zoloft sertraline. They have a little bit of sigma-1 activity, especially Luvox or fluvoxamine. And what they're doing is they're firing up the front part of the brain. We do use inositol, 6 grams twice a day. Inositol is a B vitamin derivative, but inositol is a natural derivative that people sometimes will use for OCD. It's a powder formulation typically, but it's about 6 grams twice a day. And comes out to be about a 3/4 teaspoonful of powder that people sometimes will take. And then we'll have psychotherapy techniques that can be, on one hand, very, very simple, where you're having this obsessive thought where it's going round and round in your mind. You just can't get it off your mind. Sometimes quietly or even in your mind saying stop. Simply thinking of the word stop or thinking in your mind or saying out loud very quietly, stop. Sometimes that can stop the circuitry and get yourself distracted to do something else. The more times you're able to do that and prevent yourself from going through with the compulsions again and again and again, you can kind of retrain your brain to not have to do that in a compulsive manner. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, I'm grieving the loss of a child in pregnancy. I'm sorry to hear that. I'm hurting and I'm sad most of the time and I don't know what to do. How do you suggest you approach addressing this? Well, obviously, grief counseling can always be helpful if you've had a child who whom you've lost during pregnancy. There's a couple things going on. On one hand, it's always traumatic to lose a child in the womb to pregnancy, but on the other hand, there is a phenomenon called postpartum depression. If you're later along in your pregnancy, past 6 months or so in your 9-month term pregnancy, you can have postpartum depression. And postpartum depression is where your estrogen and progesterone has been very sky high, and then they plummet. Now, granted, the loss of the child is enough to make you really depressed and be very traumatic for you. But on top of that, if you have the drop in estrogen and progesterone, that can cause you a hormonal disturbance that gives you the effect of postpartum depression. And in doing so, that can be corrected. We have a medication called zuranolone, also known as Zurzuvae, and we use Zurzuvae if somebody has a postpartum depression where the depression has had its onset in the last trimester of pregnancy or any time within 1 year after delivery, because Zurzuvae is correcting the hormonal imbalance that naturally will occur at the time of delivery, and that can include a preterm delivery if you've had a miscarriage. So you need to be assessed, number one, from a hormonal standpoint to see if that's a factor for you. Definitely getting grief counseling. It's always difficult for somebody to lose a child, but also there are antidepressant medications that can be used to try to help you cope and maintain your resilience, to be able to still do the kind of things in life and be able to look to the future. But that grief is very, very traumatic for many people. I wish you well. Thanks for your email. Let's go to our next caller. Hello, Joe. Welcome to Matters of the Mind. Joe, you'd mentioned you're taking gabapentin and trazodone. Can they be linked to an increased risk of dementia or the loss of balance? Actually, Joe, gabapentin is a medication that a lot of us older people can take over 65 years of age because it's been shown to actually deepen the quality of sleep and improve dream sleep, and less deep sleep and less dream sleep are associated with dementia. So there's a lot of speculation now that gabapentin, also known as Neurontin, originally approved as an anti-seizure medication back in the 1990s. Been around for a long time. It's now used for pain, it's used for anxiety, it's used for sleep. So gabapentin is used for a lot of reasons in which it wasn't originally studied, but it is a medication that appears to be very safe for helping with the depth of sleep, and it does not seem to have that link to dementia that we hear about with medications like the benzodiazepines, Xanax, Klonopin, Valium, Ativan. Those medications seem to have a greater link to dementia, so we're safer with gabapentin. You'd mentioned a falling risk. You bet if you take too much gabapentin, you can have an unsteadiness and have falling risk. Not as much as you might have a falling risk with the so-called benzodiazepines. So gabapentin, if used at the proper dosage, can be very helpful for many people. Trazodone, a medication that works entirely differently than gabapentin. Gabapentin works on the calcium channels, where it basically makes the calcium channels less likely to give you an itchy trigger finger. So there's less calcium influx, giving you less anxiety that way. So calcium channels are affected by gabapentin. On the other hand, trazodone is affected more by serotonin receptors. So entirely different mechanisms of action. By affecting serotonin receptors, trazodone does not seem to be giving anybody an increased risk of dementia or typically falling risk. Now, if you get too much trazodone, like with too much gabapentin, you can be a little bit lightheaded and unsteady on your feet, but generally those medications are not typically related to falling risk. Thanks for your call. Let's go to our next caller. Hello, Bob. Welcome to Matters of the Mind. Bob, you'd mentioned that your friend is having some mental health problems. How would you suggest your friend going to a therapist? Bob, the best thing you can do as a friend is give compassionate concern to your friend and just say, hey, I've known you for a long time, and here's what I'm noticing about you. Are you okay? And try to just get some open discussion there. And then the whole idea of a friend is to allow somebody to have a GPS to help them guided to their individual life goals. So in other words, if you're kind of lost on the highway, what do? Well, if you're by yourself, you flip on your GPS and you try to figure out where you're supposed to be going. And that's what the psychotherapist will do. A psychotherapist will basically be like that GPS to give you some guidance to turn here, go this way. They look at where you are right now, as does GPS, and then help you determine, okay, based on where you are right now, you need to go up a mile and turn right. Well, that's what a therapist does. Based on where you are right now, you need to go forward this way or that way, and the therapist gives you some practical ideas. Now, we do use medications. Medications will be for the role of primarily the acceleration, the braking, helping the actual the mechanics of the brain work better, so to speak, whereas psychotherapy or talk therapy gives you more of the ideas on what direction to go. So therapy can be very, very helpful for many people, especially if you're going through life circumstances in which you've not experienced previously, you haven't been able to cope with them before, thereby you don't have much resilience. And if you have a lot of changes going on in your life right now, that's where psychotherapy can be very helpful in providing the direction for you. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air concerning mental health issues, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.